Hello, my name is Dr. Cheryl Thaxton, and I'm one of the National LNEC faculty members. Today, I'm going to be discussing a practical presentation entitled Assisting Children Whose Family Member is Sick or Dying of COVID-19, Opportunities for Nurses to Provide Best Practices at the Bedside. This presentation will serve to help with understanding ways to support children when there's a situation where there's an adult patient who's admitted to an inpatient unit or intensive care unit, or that's been seen in a clinic setting. Objectives are to discuss the role of the bedside nurse during the COVID-19 crisis with caring for children of dying patients. Describe the developmental stages of children. Discuss communication strategies to provide optimal emotional support for grieving children and to promote best practices. And then identify a variety of legacy building activities appropriate for different developmental stages. So here we have a case study with a 45-year-old male who has a history of diabetes, hypertension, COPD, and now is newly diagnosed with COVID-19, admitted into the intensive care unit and placed on a ventilator. The patient is married. His wife is in the emergency room, also being seen for fever and cough. The patient's mother contacts the ICU team to ask how to best assist her grandchildren who are at home, upset and afraid, ages 5 and 14 years old. So where does the bedside nurse begin with providing support for this family? Supporting the children. This is an opportunity for nurses and healthcare professionals to actively promote and facilitate effective communication within the family. There are various blends of family structures and support members within a household. So therefore, nurses who are contacting these relatives should assume that the person who's sick has a vital role in the child's life. For this particular situation, we have a dad who's sick. No one can visit him. The mom's not home. She's in the hospital as well. This also adds emotional distress to the family and the child. The grandma is not giving information to the children in order to try to protect them. Children can't go to school at this time. They can't see their friends. They're at risk to be very frightened and scared and afraid. The quality of communication with children about life-threatening illness and death has a long-term effect on their psychological well-being and family functioning, very clearly shown in research. So, what are some key questions to consider in this situation? So, what's the meaning of illness to the family? What is the impact of what's going on? How is that going to impact the family? How's that going to impact the child? What does that mean? Is that child worried about losing a parent or possibly losing two parents? What is the child's prior experience with sickness or death? Has there been other family members in the past that have been ill? Have they lost a pet or a friend? What is the child's developmental stage? And we'll talk more about that in relation to the death experience in the next few slides. And finally, how does the family typically communicate bad news? What's the language they use when you're giving challenging or difficult news to their child? How do they typically disclose this type of information? What type of setting? And who are the support people involved in those discussions? So here's some interesting research. It looked at what children of dying family members typically ask themselves. Can they catch it? Did they cause it? And who's going to take care of them? And according to the American Academy of Pediatrics, in a 2016 report, approximately 1 in 20 children in the United States experience the death of a parent by the age of 16. Caregivers often struggle with their own personal grief, and they may be particularly reluctant or even unable to really recognize and accept a child's death. The reality is that many children in this situation could be grieving alone or postponing the expression of their own grief. So the primary role of this primary palliative care nurse would be to assess, educate, advocate, delegate, plan, and follow up. And we'll talk more about that as we go through each developmental stage. So first, let's look at infants. So infants, as you know, do not have a formal understanding of death. They do fear, however, separation, and they can be responsive to emotions that they sense or feel in the environment or the anxiety level of their loved one or family member. The reaction to death can be that the infants can be irritable, clingy, cry more, and then in terms of the role for the primary palliative nurse, strategies to maximize coping could include the nurse recommending to the family to try to keep the routine as consistent as possible at home in terms of sleeping, bedtime, eating. Um, there could be an allowance for variation, however, and then helping the loved one to prioritize the child over chores or asking for help from additional family members if they do have a lot of chores to accomplish. And one key thing may be to assign a regular support person that can help them with the infant in providing daily care. So toddlers and preschoolers, okay? This group definitely does not have an understanding of death as permanent. Death can be seen as possibly a punishment to this age group. Children at this age group can be very egocentric, have this display of magical thinking where if they don't have the information shared with them by the adult or caregiver, they're going to imagine it and think up what it could be. And they also can have a fear of dying. Reactions to death include toddlers and preschoolers may show very little concern. They can have regressive behaviors in terms of feeding or toileting. They can, of course, have fear of separation. And then some may want to discuss or play out death scenes during their playtime. So strategies to maximize coping, definitely trying to prepare the child for what to expect. If they're going to visualize their deceased loved one via video, you just want to make sure they're prepared for what they may see. Many parents and loved ones with this age group in particular have chosen not to have their child see a deceased loved one. So it's really individual and per family's wishes. But the key is really to be consistent in wording used. So avoiding euphemisms, trying to use as concrete language as much as possible. Vague statements such as grandpa is resting in peace. That's very vague. For a child, they think resting or sleeping is equal to death. They may be afraid themselves to go to sleep. Avoiding misconceptions, and again, allowing them to have playtime or play out death themes. School-age children, okay, so they really have more interest in the biological aspects of death, and they may sense some irreversibility of it, but they're beginning to really perceive that this may be possible for themselves, and they can worry about those types of things. The reactions to death can include increased crying, anxiety, and this is the age group where you may see some physical signs related to the stress. Headaches, stomach aches, they can have denial, hostility, they can have a sense of blame or guilt for something they've done or said, and they can also be withdrawn or have some periods of inattention. Strategies to maximize coping include exploring possible reactions with the child, giving the child permission to show or maybe not show emotions, providing honest explanations for the death to the child, and then exploring legacy building opportunities, which we'll review in the next couple of slides. And of course, it's important to listen or validate the child's experiences. Adolescents. So, of course, they have an understanding of death. They are able to think more abstractly. They have a more mature understanding. They can understand the implications of death, what was caused as related to the COVID, and they can really acknowledge that life is fragile, and some still have a sense of invincibility. Reactions to death can also vary, but some children are worried if they need to prepare to assume a more adult role. Some adolescents can be preoccupied with the death experience, can show regressive or risk-taking behaviors, or can become more critical of adults or parents in their immediate environment. Strategies to maximize coping include some of what we mentioned earlier, But in particular for the adolescents, really making sure that if they want information, more information about what happened, you can provide some honest information. And then making sure that they have opportunities to vent their frustration or their worries. And sometimes they may manifest their grief through music therapy, lyrical writing, or poetry. So making sure that you have some type of outlet for the adolescent to express their feelings, because it may not be in a typical fashion. So preparing the words, and these strategies are typically provided by the nurse educating the family on how to move forward, but really not necessarily implemented by the nurse. So in these situations with COVID, we are often seeing where the bedside nurse is educating someone via phone or video on how to provide support for the child. So really preparing the child for what to expect, discussing simple details, remembering that some preschoolers are more advanced than others in knowing colors. So, they may hear certain words and wonder about what you're saying. But as you're partnering with the caregiver or parent to provide the support, you're going to make sure that you're telling them to prepare the words ahead of time, being concrete, making sure that they're mentioning words listed here, such as death, died. If younger children want an explanation of what actually happened to the body, the body stopped working, the heart stopped beating, lungs stopped breathing. However, for all age groups, it's vital to stress that he or she does not feel pain. I think that's a worry that children in general may have, including adolescents. So that kind of reassurance is really vital. Again, avoid confusing terms and cliches, and then allow for a period of silence, even if by phone. And prepare answers for questions, both existential and concrete. And then also, if families want to have chaplain support or chaplain call them, having that resource available as well. So additional tips for the discussion, we talked about discussing the facts while paying attention to the child's developmental level. And then also identifying the best person to provide disclosure of the death. So this may or may not be the parent. So you need to talk through who they want to help disclose the information to the child. And then remembering it's okay to express emotion if you're speaking to the child or family via video call or telephone. And one vital aspect is to really seek partnerships. So when we talk about delegation, you really are going to call on your child life specialist partners and your clinical social work partners who are experts in this type of support for children. After disclosing information, you really want to make sure you're communicating language consistently, making sure that the caregivers for the child are allowing for play opportunities, and identifying ongoing support person or people for the caregiver, and then offering legacy building opportunities. And here we're mentioned a couple here. So legacy building opportunities and activities allow for family members or child to say goodbye and to share their feelings. And objects or projects made by the child may be shared or kept private. And in this instance with COVID, some children may choose to keep their projects at home, put them in a special place for their loved ones so that they can look at or share details about the project later on. A couple of examples for legacy building activities include allowing the child to draw a photo of the parent or grandparent or loved one as a gift. And since visitation to the hospital may not be possible, allowing the child to put that drawing in a special place within the home setting. Next, another option may be planting a small tree or flower bed together with the child outside in honor of the loved one that they will no longer see, but that they can really treasure special times outside, watering the flower bed or having some type of ceremony when the tree is planted. And then here we have a picture of the construction paper used to make a paper chain and letting the child give each color a name or phrase in honor of the sick or deceased loved one. And for young adolescents, As I mentioned earlier, writing poetry or lyrical music in honor of the loved one is something that has been shown to be effective in research as well. Here's some quick resources or books that may be good to use. Again, making sure that the bedside nurse is letting the caregiver know that it's best for them to browse through these books ahead of time before reading them to the children, so that they know which, special words or cues would, be most impactful to the child, or that they need to kind of avoid. In conclusion, the nurse must utilize a developmental approach when caring for children whose family member is sick or dying of COVID-19. The nurse must assess, educate, advocate, delegate, plan, and follow up while providing support to children whose family member is sick or dying of COVID-19. And it's vital for the nurse to seek to partner with child life specialists and or clinical social workers who are experts in this type of support for children. Thank you for this time, and please feel free to tap into the resources here on the reference page